Good afternoon. Today I'm going to be talking about disabilities and differentiated instruction in the classroom. So the first disability that I'm going to talk about is learning disabilities, which affect 36% of all students with disabilities and is the most prevalent of all disabilities. It's 2 times more likely in boys than in girls, and there's many characteristics of a learning disability, such as reading or dyslexia, math disabilities, memory disabilities, and social and emotional needs, which is the invisible disability. Ways to help students with learning disabilities in the classroom could be breaking down information and verbalizing what they have learned, storing information in graphic organizers, and making it easier for them to receive the information. Students with learning disabilities need to be able to understand their disability and set and achieve reachable goals. They need to be able to solve and make their own decisions independently and advocate for themselves to direct their learning. The next is communication disorders. A communication disorder is any disorder that affects an individual's ability to comprehend, detect, or apply language and speech to engage in communication effectively with others. This can range from simple sound substitutions like a lisp or a stutter to the inability to understand their native language. Some differentiated instruction would be reducing auditory and visual distractions while the student's trying to speak, including visuals in your instruction. Talk boxes or iPads are useful when the student can press on a picture and the technology will speak for the student. And if the high-tech option is not available, a low-tech option would be a laminated mat with pictures where the student can point to what they're trying to say using pictures. The next disability is emotional and behavioral disorders. Emotional and behavioral disorders is defined as a condition with one or more characteristics that over a long period of time negatively impacts the child's learning. The child may not be able to build relationships, they may have inappropriate behavior in normal situations, they could be unhappy or depressed for a long period of time, and there can be physical symptoms associated with other problems. There are external and internal behaviors associated with emotional and behavioral disorders, such as external could include disruptive behavior, annoying or aggressive behavior, and being non-compliant. And internal behaviors could be the student is withdrawn, they have depression and anxiety, and they are fearful. Some examples of emotional and behavioral disorders are anxiety, mood disorders like depression, oppositional defiance disorder or ODD, and schizophrenia. Ways to help the students in the classroom is to have a behavioral plan and to guide them in the right direction, as well as conflict resolution. You can also use mediation or group problem solving, have class meetings, and cooperative learning. It's also a good idea to choose your battles and to not over-exaggerate things that can be easily ignored. The next disability is attention deficit hyperactivity disorder, or ADHD. ADHD is categorized under the other health impairment, or OHI, and 2/3 of OHI are ADHD. 7% of students have ADHD, and it's 3 times more likely to happen in boys than it is in girls. Some characteristics of ADHD could be that the student struggles to keep their hands to themselves, they can't stay in his or her seat, they could be loud, on the go, talk a lot, blurt out answers in class, they can't wait for their turn, and they often interrupt others, which can be very distracting for the class as a whole. Ways to accommodate these students in class could be flexible seating or allowing the student to stand up when needed, the seat location, giving the student more time, ignoring small behaviors and outbursts, rewarding the student for positive behavior, making to-do lists to help the student with organization, and also monitoring their social interactions and making sure they're staying appropriate. The next disability is autism spectrum disorder, or ASD. Since this is a disorder on a spectrum, it can go from high functioning to low functioning. High functioning could be something considered Asperger's, which is when students can excel in certain areas and really not excel in others. It's much more common in boys than girls, and in 1 in 54 boys are diagnosed with autism, and 1 in 256 girls are diagnosed with autism, so it's a big difference. Two basic characteristics of autism are repetitive behavior and social and communication skills. So you may need to specifically teach a student with autism what to do or say in a social situation. They also may need speech services. A lot of times they have sensory issues with sound or with touch, and this can show as these signs can show as early as infancy. When touching trying to soothe the child, they may arch their back instead of welcoming being soothed. 50% of students or people diagnosed with ASD are aggressive, but the aggression is not meant to be mean or to cause harm. It is just their way of communicating, and it's very hard for them to communicate their emotions. We actually don't know what causes autism, but there are ways to help in the classroom. Working with their repetitive behavior instead of against it. So if a student rocks back and forth during class or just all the time, giving them a rocking chair to rock back and forth in instead of inhibiting their ability to rock can help with their learning. Keeping a routine, and if it changes, letting a student know. Taking things step by step and staying in that order, and setting realistic expectations for the students. When it comes to social situations, you can use social stories to help them with social situations. The next disability is the intellectual disabilities, which is when the IQ of a person is lower than is 70 or lower. A very common example of an intellectual disability would be someone with Down syndrome, where they can also have extra health concerns such as hearing loss, heart problems, or problems with their sight. And some physical differences in a person with Down syndrome could be almond eyes, flatter faces, specifically in the nose, having a tongue that sticks out, having smaller hands and feet and shorter fingers. Inclusion in the classroom can include dictating responses to a scribe, giving a student with an intellectual disability extra time, having tests read aloud to the student, and clarifying test questions. And students with intellectual abilities should be incorporated in the classroom as much as they possibly can. The next disability would be traumatic brain injury, or TBI. TBI is defined as an existing injury after birth that's caused by an external force, and it can be an open or closed head injury. Some characteristics of TBI could be a learning disability, speech disability, physical disability, and emotional behavioral disabilities. Cognition can be limited to the age of the injury and the extent of the injury. For example, if a student was in a car accident at the age of 6, they could be 25 and their cognition and brain function could only be limited to the age of 6. There's lots of causes. One of the most common causes are car accidents, but also sports injuries, drug abuse, assaults, and just any extreme force to the head could cause brain injury, traumatic brain injury. So ways to accommodate these TBI in the classroom would be to slow down, not overstimulate the student with a lot of sound, lights, and visuals, giving the student time to process the question that you've asked and to process their answer, so being very patient with the student, and shifting down to the bare essentials and not adding a lot of fluff or bells and whistles into the instruction. The next disability is hearing loss. A student could have difficulties in different areas when it comes to hearing loss. So the student could have difficulties speaking, reading, or writing. Some adaptations in the classroom could be lip reading, having very little background noise in the classroom, so that if they do have a hearing aid or a cochlear implant, it's not muffling the sound of voices with background noise, and also learning some ASL so that you can assist them by using sign language. And a lot of times students with a hearing disability will have a sign language interpreter with them, but once the student gets older, it is important to make sure that they are learning to function on their own without the sign language interpreter with them. The next disability is visual impairments and blindness, and the levels of blindness can vary from just macular degeneration, just gradual blindness. Sometimes people have illnesses that cause them to gradually go blind over the course of time, and sometimes a student can just be fully blind. And ways to help students with visual impairments could be tilted desks to help with their vision, as well as posture, so having their desk tilted up so they don't have to bend over. Making sure that the lighting is very good so that they can see the paper very clearly, and using technology to make pictures and videos and text larger, so iPads or other magnifying technology. It could just be a magnifying glass or a large magnifying block, or it could be an iPad, as well as some students will know how to read Braille or need to learn to read Braille. Lastly, we have the gifted and talented students. Gifted and talented students could be defined as students that exhibit high performance capability in an intellectual and creative or artistic area, and students could possess an unusual capacity for leadership and excels in specific academic fields. Some differentiated instruction could be providing more challenging materials for the student, having the student study problems that don't have clear and obvious solutions, making sure that you find topics that interest the student, maybe allowing for flexible groupings, creating specialized learning centers for specific skill work, and teaching the student specific skills needed to learn independently. Thank you very much for listening to this presentation.